One.
Hi, I'm Brady Calhoun. I'm with WMBB. We're having another Facts Over Fear session. I'm joined by Heather Kretzer, who's with the Department of Health in Bay County. Heather, how you doing today?
Doing pretty well. How about yourself?
Just another busy day in paradise, hanging out, social distancing, trying to convince people that 6 feet is too close. I'm shooting for 8 feet right about now. You wanted to talk about CDC guidelines, new CDC guidelines involving testing. So tell us a little bit about that.
Sure. Yeah, what we want people to know is that currently with the testing supplies that are available, the situation is that the CDCs recommend priority levels for testing. So with the current situation in Bay County, we are under priority 1 and priority 2 for those testing. So priority 1 is people who are in the hospital or persons that work in healthcare facilities. Under priority 2, you have persons that are in places like nursing homes and assisted living facilities with symptoms, people that are over 65 with symptoms, people who have underlying health conditions with symptoms, and our first responders with symptoms. Now, is a priority level 3, but thankfully Bay County is not in that priority level yet. That would mean that you're seeing increased hospitalizations within your community, and that's when that particular one would trigger. Again, thankfully we are not there yet, and hopefully everybody follows the governor's order that has just been released, and we can maintain some of the lower levels and keep our persons that are most at risk out of the hospital.
Absolutely. And Heather, I mean, you know as well as I do, there was a lot of, at least in the community, there was a lot of concern that there weren't enough tests and that people couldn't be tested if they had the symptoms. Does this address some of those issues, you think?
Well, I think partly it does. Of course, more people want to be tested that may have symptoms that may not be in those categories. But what we can say is that for those persons who believe that they have symptoms, they believe that they have it, they're not in those priority levels, we're going to be giving those same instructions to them as we would somebody who did test positive or was testing for the illness. So that's going to be to stay home and self-isolate within your home. So if possible, you want to have one room that you can go to within your home and one bathroom that just you only are using. Of course, continuing to follow in the hand washing and cleaning of linens and making sure whoever's cleaning those linens is wearing gloves if they're soiled. Also cleaning regularly touched surfaces and things like that. And then the persons that are caring for them and the person who's sick should wear a mask. Those are the only reasons why the CDC recommends wearing masks, is if you're sick or if you're caring for someone who is sick. We also do recommend that those persons separate themselves even from their pets. It's still undetermined whether or not this particular strain of coronavirus can affect their pets, but we just want people to be as safe as possible and keep everyone in their family safe, including their four-legged family members.
If you're sick and you don't know you have it, or you can't get a test and confirm that you have it, what are sort of the telltale signs that I need to go to the hospital? When do I get to the level of I can no longer be cared for at home?
So what you want to watch for is, difficulty breathing, blue lips, any new confusion or anything that might come on. Some of your normal warning signs that you would have that you need to go to the emergency room. So those would be the types of things to watch for. And we do recommend that those persons, whether they've been tested or they just are not feeling well, they do need to watch for those emergency warning signs and make sure that they get immediate medical care. And either themselves when they call in, or if they have a family member that's caring for them to call in, let them know that they have been having some of those symptoms so that the emergency rooms and things can be prepared for their arrival and provide them the appropriate level of care.
Is there a special way to get somebody like that into the emergency room so that they're not impacting other people in the waiting room or whatever?
Yeah, the hospitals have their CDC guidelines, and so they have different protocols, and they're following those. And that will allow them to be able to be prepared for that person's arrival and make sure that it doesn't impact, other people who might be in the ER or in the waiting rooms and things. And of course, the hospitals locally have limited their visitations. I know Bay is, doing the virtual visitations, and at Gulf Coast with their pediatrics and their labor and delivery, they are doing support persons, like one support person only. So those are, things that the hospitals too are doing to keep additional persons from being impacted, but they'll also, do some additional cares if they do have somebody come into their facilities that they believe might be a COVID-19 patient.
Well, and obviously the best way to combat this thing is not to catch it. So what's the latest guidance from the CDC and the Department of Health to keep yourself and your family safe?
We've been talking a lot about that, of course, with social distancing, which is a new term that we've all learned over this. And, learning all these new things, even as a person who works in it every day, it can be difficult to kind of keep up with it. So we can definitely understand that people at home are craving that information. But so that social distancing is going to be, going out only for your essential needs, which now is going to be a governor's order, as of midnight tomorrow night. So that is just, going to the grocery store once a week, shopping during non-peak hours, using delivery services if possible or pickup services. And then also, even when you're, if you have somebody in your home, if you are having to go out for those essential services, you work in an essential area, if you have someone in your home that is over 65 or has an underlying health condition, you really should look at how you're practicing social distancing even within your own home. Making sure if you come home after you've done that, making sure to wash your hands very well before you interact. My son has asthma, so when I come home from work, I'm making sure to wash my hands and everything. Taking off my shoes, making sure we're cleaning the surfaces and things. Even though we're social distancing at work and things like that, I'm still taking those extra precautions to protect him. So that's something that people may want to think about if they have someone like that in their family. And, the majority of us probably do.
Absolutely. So the governor did issue a stay-at-home order. It goes into effect Thursday night, and I know that we're all still sort of reading the order and reading the instructions, but what can you tell us right now about what that means for everybody in the state?
Sure. So the stay-at-home order really applies to those persons 65 and older, and also to those people with underlying health conditions.